far as pedestrian lighting and even street lighting. Keep lighting in projects, keep signals in projects, add audible signals where
We're going to begin our joint City of Corpus Christi and Nueces County press briefing on COVID-19. We do these every day, Monday through Friday, at 5 o'clock to inform the community of important matters relative to COVID-19 that can help them stay healthy and protect lives. And we also give updates on statistics that we're tracking to help understand the virus and how it's transitioning through our city. So today's press briefing will begin with me. I'll talk about our statistics in terms of the tracking of the COVID cases and number of persons in the hospital and so on. And then Annette Rodriguez, our public health director, will talk about today's drive-through testing results. We had another drive-through testing event at the former Memorial Hospital parking lot, and we tested 83 persons, so she'll give us a briefing on that. She's going to do a little bit of appreciation for public health district staff, some comments there. We know those folks are dedicated, hardworking persons. We have over 100 people in our joint city-county health district department. And then she'll also talk about where persons can donate breathing machines, known as the CPAPs and the BiPAPs. There's donations that can be made, and where to drop those off is what she'll tell us about. County Judge Barbara Canales is here with us this afternoon, and she'll talk about updated county orders and the implementation of those orders in our county. And then we'll close with Mayor Joe McComb, who's going to talk about the Mayor's Disaster Recovery Fund, how that's coming along. There's been a lot of great contributions from the community, both in terms of monetary and other ways to help our community get through this, but he'll talk about his program. And then he's also going to talk about his efforts engaged with the governor's office. He was on a press conference or a teleconference call today with the governor's office, and tomorrow he'll be speaking with others as well, so he'll brief us on that. So I'll begin with the test results, the case results from yesterday. Every day at 4 o'clock for the past 24 hours, we review the number of cases of COVID in our community. And we also look at changes in hospital stay, condition of persons, and that type of information. So yesterday at 4 o'clock, we had 90 cases. When we look at today, 24 hours after, we have one additional case for a total of 91 cases in the county of Nueces. That one additional case is within the city of Corpus Christi, and it was from a private lab, and I'll talk more about that later. So a total of 91 cases, one additional since yesterday. And as you can see in the graph, we've had a pretty decent spread, run, I should say, in terms of number of additional cases. Last week we had 2, I think that was Friday. It dropped down to 1 additional case on Saturday, and then zeros for 4 days in a row. And then today we have just 1 additional case. We have 1 total death in Nueces County, and I did want to point out that it's not in the city of Corpus Christi. So in the city of Corpus Christi, we're still with 0 deaths, but we do have 1 death in the county of Nueces. The distribution between male and female is still pretty even. There's 46 male persons that have had or have COVID, and 45 female persons have COVID, for a total of 91. And then when we look at the age distribution, we're tracking it under 9 different age groups from 0 to 90 plus years of age. The majority of our cases, though, are pretty equally distributed amongst 6 of those categories from the ages of 20 to 79. They're pretty evenly distributed amongst those 6 age groups. But the key thing to remember is it doesn't matter your age. COVID can spread to anybody, and anybody can be affected, even the youngest and the oldest as well. Testing is important, and that's something we've been reporting on and educating the community on. We want to remind the community that the city doesn't control testing, the federal government does, and that starts from supplies to protocol to guidelines we've followed and have consistently done so. The Center for Disease Control guidelines were required to do so. We are doing tests. In fact, today there were 114 tests performed in the county, both from the city's staff and network group, and then from hospitals, clinics, and physicians. They tested 91 persons. So the city had 23 were tested. Our drive-through testing that Annette will talk to us about, 83 persons actually went through. We were able to perform 23 tests in our lab, so we're reporting 23 today, 91 from the private physicians. So in total, since we've been tracking, we have now a little over 1,800 tests performed in our community, 1,806 to be exact. And I did want to point out, of the 23 that we took in our labs today, or analyzed in our labs that came from the drive-through testing site, none of those were positive, so they were all negative. The remaining of the 83 are being conducted now, and we should have those results by midnight tonight, so we'll know. But the drive-through testing, 23 of the 83 today, all of those were negative. The one positive was from a private doctor that tested somebody. And so of the 91 persons, 76 with that additional one, yesterday it was 75, but 76 are residents of Corpus Christi, 2 are from Robstown, 7 are from Port Aransas, and then 6 are from rural Nueces County. And that gets us to that total of 91. We report on recovery rates as well now to kind of show, because it's been a couple of weeks, that if somebody has COVID, they can recover, and they do. And so as you can see in this graph, this slice is getting bigger now. Without a great number of new cases, our percentage of recovered is at 30%. Recovered. That means 27 persons of the total 91 have recovered, which is good. When we talk about hospitalization, there's been 20 persons in the hospital with COVID since we've been tracking this. 15 are no longer in the hospital. There's a total today of 5 in the hospital, and one of those is in intensive care situation. So the other 4 are recovering under normal conditions in the hospital. And that chart shows the one death that we've had as well. So that circle's looking better, and we hope it continues to look that way. The final thing I'll talk about is the firefighter paramedics that were in quarantine still are in quarantine. So the captain, who's married to a wife who's a nurse, who tested positive at one point and then negative and then was positive again. Both her and he went through the drive-through testing site this morning. We don't have either of their results back yet, so the captain and 6 other firefighters will remain in that isolation situation until we get their results, which should be later today. So that concludes my introductory and statistical remarks. We're going to turn it over next to Annette Rodriguez, who will talk to us about some of the health district issues.
En resumen, en las últimas 24 horas en el condado de Nueces se ha reportado un caso adicional debido al virus. Actualmente en el condado de Nueces existen 91 casos confirmados por el coronavirus. Entre esos, 46 son varones y 45 son mujeres. La mayoría se encuentran en el rango de edades de 30 y 39 años. En total se han llevado a cabo 1,806 pruebas entre hospitales y el Distrito de Salud Pública. 27 de los 91 casos se han recuperado por completo, 20 han sido hospitalizados, 15 han sido dados de alta del hospital, 5 continúan hospitalizados y 1 se encuentra en condición crítica. El día de hoy se tomaron 83 especímenes y se ha obtenido hasta el momento el resultado de 23 de ellos. Todos resultaron negativos. El caso nuevo adicional vino de un laboratorio privado. El día de ayer le reportamos que un capitán de bomberos estaba siendo monitoreado pendiente de los resultados de la prueba por el virus. Una vez que esos resultados se reciban, se hará una determinación. 6 bomberos adicionales con quienes tuvo contacto fueron puestos bajo cuarentena como medida de precaución.
Thank you. Annette Rodriguez, Health Director. So the drive-through went extremely well today. It was very humid, but it went well. We had 83 people that went through the drive-through, and so that was very exciting for all of us to see how well it worked. This is, of course, the highest number of collections that we've ever had in a single drive-through. The drive-through, just to remind people, it helps to reduce the number of non-critical patients inundating the emergency department so that the critical patients that require emergency care can be seen. So it's very important that people going through the drive-through understand if they feel like they need emergency care, they need to not be waiting for the drive-through. They need to actually call the emergency room, let them know that they're coming, that they think they have COVID-19 symptoms, and get themselves there as quickly as possible. So our next drive-through is scheduled for Monday, April the 27th at 8 a.m. As our economy looks at, the governor making preparations to reopen in a phased approach, the community needs to be reminded that a very effective tool to reduce the spread of the virus are masks. And so masks are highly recommended. Make sure you're wearing those masks in places where social distancing is unavoidable, such as sometimes in a pharmacy area or in a physician's office or grocery stores or other similar places, any place where it's very hard to distance yourself at least 6 feet. I also wanted to take this time, as the city manager Zanoni mentioned, to say thank you to my staff. They've been working day in and day out to ensure that Nueces County and the city of Corpus Christi have the best response to this pandemic that we can provide. The laboratory people as well, our staff there, they continue to produce a very short turnaround time for those results, and we all are waiting for those results. So thank you to both the health district staff as well as our laboratory staff for all that you do. It is really appreciated by the whole community, but by myself as well, so thank you. It takes an enormous amount of time and effort and everybody working together to put the drive-through together, so thank you as well to Krista Spahn and to Driscoll for doing that and helping us with that, because it's an undertaking. CCPD as well as Nueces County Sheriff's Department, everybody working together for the good of this community. I also want to talk about the BiPAP, CPAP donations. So we finally have some dates that are available. Anyone wishing to donate their machines, these are the sleep apnea machines that a lot of people, we have some ourselves at our homes. If you're not using them anymore, this would be a good opportunity to kind of do some cleaning, get rid of them, give them to us, donate them. The tubes, the mask, whatever you have, if you have all the parts together, that's even better. So they can actually now be delivered to the West Campus at it's on Old Brownsville and Airport Road, and it's April 28th, 30th, and May 1st from 3 p.m. to 6 p.m. So if you have those machines, drive through there. They're going to have signs. Everything's going to be, so you know how to get there. Drive through there, drop off that machine, and we'd be very grateful. The program will ensure enough ventilators are available for COVID-19 patients. So in the event, we're hoping this never happens, but if they have a surge and there's a need for additional oxygen to patients, we could use a CPAP machine or we could use a BiPAP machine. So again, for more information on the CPAP BiPAP donation program, you can call us at 826-7200. Thank you.
En resumen, hoy tuvimos otra exitosa toma de especímenes. Fueron 83 las muestras tomadas. Este es el mayor número de colecciones de muestras que hemos recolectado en un solo día. Esta toma de muestras ayuda a reducir la cantidad de pacientes no críticos que inundan las unidades de emergencia. Nuestra próxima toma de especímenes está programada para el lunes 27 de abril a las 8 de la mañana. A medida de que nuestra economía se prepara para reabrir, la comunidad no debe olvidar que existen herramientas de prevención para reducir la propagación del virus. Se recomiendan cubrebocas. Asegúrese de usarlos en lugares donde la distancia social a veces es inevitable, como farmacias, consultorios médicos, supermercados y otros lugares similares. Quiero aprovechar este espacio para agradecer a todo mi personal que ha estado trabajando día tras día para garantizar que el Condado de Nueces y Corpus Christi tengan la mejor respuesta a esta pandemia. El laboratorio que ha seguido produciendo un breve tiempo de respuesta en los resultados y todo el personal. En cuanto al programa de donación de ventiladores para respiración, el Colegio Del Mar va a recolectar y desinfectar los aparatos donados. Las personas interesadas en donar las máquinas CPAP o BiPAP pueden hacerlo llevándolas al Colegio Del Mar Campus Oeste, ubicado en Old Brownsville y Airport, los días 28 y 30 de abril y el 1 de mayo de 3 a 6 de la tarde. Estas máquinas normalmente ayudan a las personas que sufren de apnea del sueño, pero también pueden ser utilizados como sistemas de respiración asistida. Para más información, llame al 826-7200.
Thank you so much. Good afternoon, Barbara Canales, Nueces County Judge. Today I thought we would recap some of the big things that happened this week and the things that are happening, of course, today, right now. And I think it's always nice to echo the thanks that I have heard earlier today. And we, of course, given tribute to, as it's deserved, to not only our partners that are working in the labs and at the health department, and the city and the county, but I really want to say thank you to all the residents of Nueces County, because I think you've doing your part, have created this very low bar graph that you've shown earlier. And so how about just a big thanks to all of you here today that are listening. The spirit of our community in honoring the stay-at-home order is something I am incredibly proud of. And the sacrifice is real, and the sacrifice is different for all of us. Some of our neighbors cannot go to work. They are unable to serve tables or work at the resort on the islands or run their small businesses. Some of our neighbors, on the other hand, have to go to work. They are our first responders, our EMTs, our doctors, our nurses, sheriff deputies, police, constables, bus drivers, and all out in the public and at a greater risk of infection to themselves and to their families. And those who work to make the modern life possible, the people who work at our utilities, people that keep those lights on for us and the AC running and the water flowing and the telephone and the internet. And all those who are working to stock the shelves at the grocery stores and the to-go orders at the restaurants. And they keep us fed, and life would not be possible without their work. And I don't know about you, but I've talked about how it seems like I can think more clearly during these times of crisis, but I also want you to know I think I can see more clearly, and I bet you can too. And so it just doesn't, it's not lost upon me when I pick up it to go that somebody made that food and somebody's there bringing that food out to my car. And I'm just very mindful, and I want you to be mindful too, and to give thanks to all these people, those that have made the sacrifice that they can't be at work, and those that are making the sacrifice to keep all those essential services running for us who are. And so our children that are home from school, from sports seasons and academic competitions, and I don't know, it just made me feel like all of a sudden May brings the concept of ideas and milestone events like prom and graduation, and how different everything must be for our seniors. And everyone is trying to learn how to do the distance learning in a world where not every family has the internet and not every family has a computer, and some have to share one device for many, both mom and dad and children. And our teachers are doing this heroic work as they work remotely, teaching and trying to keep our students moving forward and learning. And so I wanted to recap a little of the human emotion. Sometimes I come in and it's really all about the things that we're doing and the orders that we're asking you to obey. And I thought it might be a good moment to think about all of these things that are going on in our society. And what we're going through the most is probably a recognition and a realization that this is the most significant life event of our entire existence. I cannot imagine another more significant event in our lifetime, and I really want to repeat that. What we are going through is most likely the most significant event of our lifetime, and I need you to really acknowledge. It's good to acknowledge that there is real sacrifice, there is real fear, and there is real loss out there. And it's not just here in Nueces, it's all across the Lone Star State, and it's all across our country and our world. But we also have seen real examples of real service, real generosity, and Margaret Fertilla is here, so let me say that generosity came to us like it's come to the city last night in the way of dinner, and we're so grateful. And so in this example of real service, I'd like to acknowledge that there's real hope and there's real triumph coming. And we are moving forward one day at a time, and we want to put this behind us. I know we do as quickly as possible, but we do not want to do the things that could set back our progress. We don't want all our work to be in vain. And so what I said on Tuesday remains, and I like to repeat things that matter and are important. We need to lock in these gains, these zeros and these ones. They need to lock these in. Let's keep them there. And so on Monday, I signed an order aligning Nueces County's emergency orders with the governor's emergency orders. And we aren't returning to normal yet, but we are getting ready for this new normal. We expect there'll be some new guidance on maybe tomorrow, and if not tomorrow from the governor, maybe on Monday. And I believe that the rules that we changed regarding non-essential surgery and medical procedures, that started on Tuesday. And I'm happy to say that, as I mentioned on Tuesday, that our hospitals and doctors have started booking these important procedures. And this is important for our health, and many of these procedures were prohibited before, and so are open again. And I think that that's important when we recognize that a minor condition can become a major condition if you don't take care of it. So I'm happy that we are restarting this particular avenue in our medical care, and we're still reserving capacity for those that are affected, and we're still reserving PPE. So I think this is a good balance that we've struck. Now tomorrow, we begin the second safe strategic reopening of select services, that's kind of the buzzword, select services and activities in Texas. And this goes into the retail to-go arena. And that retail to-go model allows retail outlets to reopen starting Friday, April 24th. And under this model, the reopened establishments are required to deliver items to customers' cars, homes, or other locations to minimize contact. And so these two orders that we've just talked about allow us to continue our efforts to contain COVID-19 while adopting very safe standards that will allow us to begin the process of reopening Texas. So while I want us all to move forward, I want us to be cautious. And our cautiousness must really, be enacted with smart, safe, synchronized, strong, swift actions. And I think that we all want to be smart and safe. And so again, I'm always going to look to the data and to the doctors to help drive the decisions that we're making at Nueces County, that I'm personally making on the behalf of the health and safety of our citizens. And I do believe that we are going to see some restarting of businesses. And so in that vein, what I've done is yesterday in Commissioner's Court, we held a workshop that lasted the workshop plus Commissioner's Court was a 9.5 hour, event. And we got a tremendous amount of information to the public by way that we streamed these workshops and Commissioner's Court meetings. And I think that it was an incredible exercise in governance. And I hope that if you didn't get a chance to see that you can go back and watch and see some of the information that was presented. But I think that one of the things that came about was the idea that we can start working now to develop the protocols that we know are going to be necessary in the restaurant arena. We started yesterday with working with clergy. And I think it's going to really yield the type of not orders, but guidance that everybody can follow to be safe in this new normal. And so I think that what you can see from us in the county level and through our emergency operations is a real dedication to making certain that we are really getting input, soliciting input from the different industry leaders. And I think the most important thing we can do is emulate best practices. The governor has put together an advisory council, and that's to give him information and advice on all aspects of industry in the state, and I think we should do the same thing here. So yesterday, we started that process, and we asked commissioners to assist us in helping kind of guide the way through some of these new guidance mandates. And again, really, mandates is the wrong word. It's really just guidelines. And so we started with the clergy, and we got a lot of people at the faith-based community together and said, if you're going to open church on the weekend, Give us some guidelines on the protocols that you can go above and beyond what the governor's guidelines were. And we're already working together and getting those, and we hope to post those tomorrow for clergy and members of the faith-based community. And the same thing is true for restaurants. We're working with the Texas Restaurant Association, and I'm going to be asking citizens of all parts of Nueces County to help me as we form an advisory council so that we can figure out how to keep advising industries that are local to go above and beyond to continue to keep us safe. And finally, I just want to say that you, the residents, have risen to the challenge, and your high levels of compliance are definitely showing improving results. I don't want to mislead you. There are always texts, emails, and photos that I receive. I guess I'm like the mother whose children are out there not behaving, and everybody loves to come send you the pictures of them. I get all the pictures. So anybody that's not practicing the good social distancing, rest assured there's a neighbor or somebody in that store who is taking your photo and showing that they're not practicing. But I want to say that I know that we can together continue locking in these gains, continue seeing these bar graphs at an all-time low. And we will continue to make smart, safe decisions. Finally, there's been a lot of discussion of masks. At our workshop yesterday, we simply ran out of time. We heard from so many different citizens and presenters. What we decided to do was on Monday, continue the workshop. So on Monday at Commissioner's Court, we're going to have another opportunity to discuss even more information about what's happening in your community regarding COVID. And just as a recap, we talked about testing, we talked about treatments, we talked about hospitalization, we talked about our own command response. We had the Texas Department of Emergency Management there. It was an excellent opportunity to receive information. And we didn't get to the masks, but I want you to know that, yes, we're considering it. We're considering it where it's smart and where it makes sense. And so I think that I will leave you with that, not necessarily to tease you, but to tell you that we're coming back on Monday to have a robust discussion about that. And I've gotten a lot of input, and I'm grateful to you, the community. You don't have to be a medical expert to give your opinion. I want you to know that. Even if you're not an MD, I value your opinion. If you're not a business tycoon or icon, your opinion matters too. So please, reach out to us. If you feel like you have something to say, I'm here to listen. So I want to thank you again for giving us the opportunity to serve you. And again, I believe your government is just a shining example right now of what it means to serve. I'm grateful to my partners, and I look forward to being with you next week again.
En resumen, quiero agradecer a los residentes del condado ya que la barra de casos positivos ha estado disminuyendo. Mucha gente ha realizado grandes sacrificios, y unos no yendo a trabajar, otros no recibiendo salario, así como aquellos empleados que trabajan para servicios públicos o las tiendas de comestibles. También aquellos estudiantes que van a perder ir a un partido deportivo o que no podrán tener una ceremonia de graduación. Creo que es un buen momento ponernos a pensar que lo que está sucediendo es un evento extremadamente significativo en nuestra vida, no solo en nuestro estado, sino en el mundo. También han habido muestras de servicio y generosidad. Como dije el pasado martes, tenemos que cuidar todo lo bueno que hemos logrado y no bajar la guardia. Los hospitales ya han comenzado a pautar cirugías selectivas y continuamos tomando todas las medidas para que nuestros empleados tengan su equipo de protección. El día de mañana los negocios podrán abrir con las nuevas directivas atendiendo afuera de sus negocios, tomando sus precauciones. El día de ayer tuvimos un taller con los comisionados del condado, que en parte nos ayudará a tomar las medidas que tomaremos, sobre todo con el clérigo. Los comisionados nos ayudarán a obtener y crear nuevas normas para guiar a los negocios basados en las reglas establecidas por el gobernador, no solo para lugares de oración, sino para otros como los restaurantes, ya que juntos podremos nivelar y aminorar los casos en el condado, gracias a la participación de la comunidad. Este lunes vamos a continuar con el taller con los comisionados y estamos considerando el uso de los cubrebocas. Quiero que los residentes sepan que valoro su opinión.
Well, thank you. I'm Mayor Joe McComb, and we just want to continue to share with you the responsibilities that we have and the number of people that are talking to a lot of different people. We were on the phone earlier today. I don't know whether the judge was able to join. I think it was mayors and judges. I don't know whether you were able to join that conference call with the governor this morning, trying to talk about what he's getting input for and what he's planning on doing on his Monday orders that are coming down. He's trying to gather as much information as he can, and I applaud him for that, and he's getting a lot of information from all kinds of people. And the consensus is pretty well, from what I could gather from the conversation, is there's a lot of interest in getting the state back up and running, but get it up and running right, so that we continue to maintain a healthy and safe environment for our people, and yet at the same time allow our businesses to get back to doing what they do, and that's providing jobs and opportunity and income for the great vast of citizenry in our community. We did find out that the federal government, or the governor, has established a system in order to deal with the 254 counties in Texas, so that everyone has a point of contact, and that is the same structure that they used following Hurricane Harvey, and that is working through the county extension agents in all of the counties in Texas. Out of the 254 counties in Texas, 252 of them have an assigned county extension agent. I don't know which two don't. I'm surprised that two don't, but I was surprised at that. But all of them have a point of contact that have direct input through the governor's office. They're operated, NIM Kidd is stationed at Texas A&M University as part of that university's operation, and John Sharp is the chancellor over there, and he headed up the hurricane recovery efforts and through this system, and it worked very well. And so that's going to be kind of the communication, the channel events for us to work through the state to try to get some assistance down to the communities, counties, and cities. And he also indicated that he was working with his strike force team. I think the judge referenced that. They're putting together, I'm sure, a tremendous amount of information, and this is people from across the state of Texas representing pretty much, I guess, every kind of business and interest in the state of Texas. And I think their goal is that, you know, we want to get back to work, but we want to do it safely. And they have a complete meeting tomorrow, and then I think over the weekend he'll be putting his plan together for Monday. In addition to that, you know, there's a continuing federal interest in legislation that's coming down. They're working on some additional funding for the states, and we've got a conference call tomorrow morning, and the Big City Mayor's conference call in the morning, and Senator John Cornyn is going to be with us, so that he kind of gets an idea of what the mayors around the state are looking for in some of the legislation that's coming down, because there's some of the legislation in the past, while there's been a lot of it and a lot of funding coming down, there's some confusion as to what access communities that are under the population of 500,000 have, and we want him to be aware that Nueces County and Corpus Christi, while we don't meet the 500,000 threshold, as many counties around and cities around the state don't, we serve multiple areas, and so in the areas that we serve, we do reach the 500,000 and what funds are there, and also the amount of flexibility that we have with those funds. And so I think it's going to be a good visit with him. I met just on the phone individually with him the other day and invited him to that meeting, and he's very much aware of this, and he said he'd been contacted by others, so he's very interested in what the mayors have to say. And then the judge mentioned the goodness of our community and coming together when it seems like you know, the chips are down, the community rallies. And one of the things, again, going back to, you learn from your past experience, both the good things and the bad things, and one of the good things that we learned in Hurricane Harvey, we reaffirmed, was that there's a lot of good people in South Texas and want to help their fellow citizens. And we established the Mayor's Hurricane Harvey Recovery Fund, and we started getting calls about doing that this time to help people that have different needs. Their houses aren't being blown down, but they still have a lot of need. And so we established the Disaster Recovery Fund, and to date, we've generated a little over $263,000, and that's going through the Coastal Bend Community Foundation. Last week, we delivered $25,000 to the Salvation Army and $25,000 to the Coastal Bend Food Bank. And this year, that was the first week that after we'd announced it. This year, it's been a flurry of, this last week has been a flurry of activities, and has gotten us up to that $263,000. One was a generous gift from the Ed Rochelle Foundation. We want to thank Paul Althide for that. They gave us $100,000 to the fund. And then there was another generous gift of $80,000 from an anonymous donor that just said they want to help the citizens of Corpus Christi, Nueces County. And so that brings us to a total of $263,000. And we'll be making a distribution probably tomorrow or Monday for some of that money. And then once the money actually gets in hand, we don't spend money until we have it in hand. Some of it's being transferred, and so that other fund will be distributed as quickly as possible as we can get it in. And we want to thank all the donors, both large and small, for that, because it all adds up to make our better community. But it just does demonstrate the goodness of people in our area. And so we want to say thank you in addition to the thank yous that the judge has extended to all those that have been involved. We all want to look forward to the future, and I think the future's bright. I think on all indications are there's going to be a big effort on the part of the governor and the president and the Congress and your local judge and myself and Peter to get the community working, but working safe and smart so that we don't have a repeat or a return to what we've been in. But I think the numbers are showing that we're doing things right. And I think long-term, it's going to prove to be a very good example to people around the country to see how well we have been able to respond and manage a situation, which I think will bode well for us in the future. And I just want to thank the citizenry that have responded and the leadership and those that are serving. So I'll conclude my comments and ask if you have any questions and you want to direct them to someone specific, we'll get them up here, Peter, or the judge. If not, Peter, you want to come back and okay. You have a question for Peter? Okay. Okay, yeah.
En resumen, en cuanto a la llamada del gobernador, hoy temprano tuvimos una llamada telefónica con el gobernador Greg Abbott. Él expuso una estructura sobre cómo funcionará el Estado para ayudar a las ciudades y condados a responder y recuperarse de la pandemia del coronavirus. Esto es como el plan desarrollado por el Estado después del huracán Harvey, donde los agentes de extensión del condado eran los contactos locales. El servicio de extensión desarrollará capacitación para que las ciudades y los condados comprendan las reglas y regulaciones, junto con los programas de financiamiento como la Ley CARES y los 2 primeros proyectos de la ley aprobados para responder al COVID-19. El gobernador también recibió muchas preguntas de alcaldes y jueces del condado sobre varios temas relacionados con sus órdenes existentes, estrategias que está considerando y las órdenes que se entregarán el lunes. Sobre la llamada entre alcaldes, mañana es nuestra llamada semanal con alcaldes de otras ciudades y el senador John Cornyn estará pendiente para hablar sobre las necesidades que tienen nuestras áreas y otra información. En cuanto al Fondo de Recuperación por Desastre del alcalde, me complace informar que el Fondo de Recuperación por Desastre del alcalde es de ahora hasta $263,000. Me gustaría agradecer a todos los donantes. Ya hemos entregado $50,000 al Banco de Alimentos del área de la costa y al Ejército de Salvación.
Okay, great. That concludes our press briefing for today. Tomorrow we'll be back at 5 o'clock, and it'll be myself and Annette, and also though with us will be the team from Texas A&M Corpus Christi that have been presenting us modeling and other statistical information to show various things, to include how social distancing and stay-at-home orders are making an impact. They'll have updated models that show our curve here using some of the models that are used across the globe, but with our data from the Coastal Bend region. And they're also going to show a new model that they haven't showed yet, but it shows how persons are staying at home over time. There's a curve using cell phone data that will show, and it shows that during the Easter weekend in particular, there was a drastic downturn in people's movement and staying home. So that's it. It'll be an interesting thing to see tomorrow. We'll be here at 5 o'clock tomorrow with Texas A&M Corpus Christi professors and scientists, and Annette and myself as well. And then we'll be back next week as well on Monday. So with that, that concludes our press briefing for today. We're here to answer any questions that you might have. Okay. Yeah, go ahead, Mark. Go to the microphone. For the judge.
Good afternoon. Thank you so much for what you're doing for us. And we're watching every day at 5 o'clock. We have no, words to thanks to you. I wanted to just give you a fact. About 3 weeks ago, if you see the national news in San Antonio, they had this unbelievable drive for the Traders Village with thousands and thousands of people. In 3 weeks, there were like 30,000 people. So I would like to know for all three of you, what will be the possibilities that right now the social distances, it's any problem that we can open Richard Borchard Auditorium and make a drive-through food with a food bank or any other organization. And a lot of public officials, they express the desire to come there and help to put the food in the bags, and the cars drive through, and we will just put like 3-4 bags in each car. So people, they have to sign up and eventually to be in from Nueces County, even though San Antonio was open for everybody. I heard the news from South Padre Island that they're driving to San Antonio for food. So if we have these funds, if we have this driving, if we have our general county judge, amazing leader, she can help us in that. I know that we can do it. I know we can do national news. Let's do the Corpus Christi, which is like so much, care for people. Let's do that. That will be one. That what will be the possibility to do that. The second one, being a TV show producer, I like to know if we can, at a suggestion for 100 TV show producer, if we can start this program with Don't Stop Believing, or something that like everybody's remembering. Judge Canales was like, this girl is in fire. If we can remember that Don't Stop Believe It, because I was listening to this song, Jonathan Cain, and Judge Canales yesterday, 4 hours, she was talking with all the leaders from the churches, and it was amazing. So I know the faith that we have, and why don't you give some people some hopes that they hear something, they say, hey, don't stop believing. So that's my question.
Okay, thank you. Yeah, so on the food bank, the mayor's fund, was that one of the agencies, Mayor, the food bank you contributed to? You're right. So the mayor's disaster fund has contributed a significant amount to the food bank. They're in constant communication with city persons as well. And we haven't had the situation that they had in San Antonio here locally, but we'll continue to work with them and see if they need additional resources. The judge wants to add a little bit to that.
Absolutely. I'm interested in anything that we can do to increase the food bank's, pantry. And if we can create some opportunity to highlight what they're doing so that we can increase food bank pantry shelves to be overflowing full, and then create that drive-through, I'll reach out to the food bank and see what they think about, some sort of a Nueces County operation like the one that they've run in San Antonio. And I think people are always surprised how people are hungry. I think it's always shocking. Social services is a big part of Nueces County, so I'll want to reach out to our social services chief and see what she recommends. So I'll get back to you on that piece of it. And then on the hope piece, I think that anything you can do. I'll be honest with you. I did something this afternoon that I didn't even realize was on my schedule, and it really made a big impact. And for just a moment, I thought, I don't know if I can leave what I'm doing and go do this for an hour. It was the best hour of my entire week. I spent an hour on the phone in Zoom with the Buccaneer Days King and Queen contestants via Zoom. And I spoke for just a little bit, and they asked me tons of questions about this experience. And it was so great to talk to so many young people and hear from them and what they were interested in and what they wanted to ask. So it kind of goes back to what you're saying about don't stop believing. I think that we need to do that daily as leaders. I need to somehow move away from the manic discussion of testing and statistics, and just for 1 hour a day, do something uplifting for our community. I'm going to make sure that's my mantra from now until the end of this year. So thank you for bringing that up. It highlights it for me, and I'm going to share that with other leaders. And I know the mayor does all kinds of great things every day for people. It's also National Library Week, so if any of the elected leaders want to read a book and put it on YouTube like we did this morning, make sure that you just make sure you tag us so that we can link you up because National Library Week is being celebrated in our Nueces County Library. So I hope that gives you a little bit, Margaret. Absolutely. And ¿puedo contestar algo en español?
Sí, pues, los tipos de tiendas que se van a abrir mañana. Que
El,
son
el- el tiempo de las tiendas.
tipo de tiendas. ¿Qué tipo
¿O
de
qué
tiendas?
tipo de tiendas? La pregunta es qué tipo de tiendas se va a abrir mañana. Lo que dice el gobernador, las palabras correctas, son negocios selectivas. Estos negocios son los negocios que no eran esenciales, pero ahora sí se puede abrir si puedes recoger el servicio o la... Puede ser ropa, puede ser perfume, puede ser lo que estás vendiendo, pero a su carro, a su casa o en una manera que no vas a entrar en la tienda. Entonces, es como dice, una manera to go, que es coche, ¿verdad? Que no estás en su coche recibiendo los artículos que vas a comprar. Es algo que empezamos ahora para introducir cómo vamos a hacer este nuevo normal, cómo vamos a empezar abriendo negocios. Eso es mi deseo, ayudar a los negocios que tienen preguntas, ¿cómo lo puedes hacer? Por favor, habla 414-6000. Esa es la línea privada que va directamente a alguien que se puede contestar sus preguntas. Pero esos son los negocios que no estaban abiertos antes, ahora sí se puede, pero son con directivas muy especial, como negocios especiales, directivas especiales. Entonces, esta es la manera de normal nuevo. Y este es algo diferente que vamos a empezar. Y también el gobernador nos va a dar más dirección el lunes siguiente. Gracias a ti.
All right, do we have any other questions for today? Okay, good. We'll see you all back here at 5 o'clock tomorrow. Thank you.